It's a dilemma veterinarians across our region are facing every day when it comes to life-saving procedures for your pets. Do the surgery and use up personal protective equipment, or wait it out and see what happens. It's a decision weighing heavy on one local veterinarian regarding a dog in desperate need of eye surgery.
In the center of the eye, that's where the cataract forms.
Dr. Cassandra Bliss, animal ophthalmologist, explains the dire situation for Bailey, a 12-year-old black lab.
And this is a perfect example of a case of a patient that went suddenly blind, and not only went suddenly blind, but started to develop secondary complications due to why they became blind.
Bailey's owner, Val Bradshaw, noticed something was wrong when Bailey started to lose weight. A trip to the vet discovered Bailey is a diabetic, which creates a world of problems for this pup. Dr. Bliss says 80% of diabetic dogs develop cataracts within 1 year, a condition that occurs incredibly fast.
When a cataract forms that quickly, it causes the lens to swell. And why that's important is because there's a capsule surrounding that lens, and if it ruptures, you have 24 to 72 hours to go in there and address that surgically, or they'll develop secondary glaucoma. So not only is she blind, but she's painful. And then we look at her other eye, her left eye, and you can see that lens starting to swell. And it's just that pit of your stomach, this dog needs surgery yesterday.
On top of that, Dr. Bliss and her team have to agree this surgery is essential and the use of PPE is justified.
When it comes to something that's actually going to use personal protective equipment that might be necessary at some point to treat a COVID patient, you're suddenly in this ethical dilemma of going, okay, if delaying this procedure for more than 3 months would either harm that organ and or harm that patient, then you need to make the choice to do that surgery.
Her other dilemma, how many times does she get to make that choice?
I have 20 gowns. So whenever this started to the time that it ends, I get to make that decision 20 times. And am I taking that from 20 COVID patients? It's a difficult decision, especially as a small business owner. This is all I have.
When they decided surgery was a go, Bailey needed a complete workup to make sure she was healthy. That's when they discovered a urinary tract infection, which has to clear before surgery can begin. So now it's just a waiting game.
We're carefully monitoring this left eye that at any point could rupture while we're treating a urinary tract infection.
We're hoping that it's going to come back negative so we can do the surgery because it's getting detrimental.
Bradshaw says she's grateful the Bliss team is moving forward with surgery. In the few minutes I spent with her, it was clear she'd do just about anything for this dog.
Yeah. I'm sorry. Yeah. I grew up on a ranch. I live on a ranch. And that's my job. Taking care of animals.
That's your girl.
That's my girl.
Most definitely her girl. On a typical week, Bliss's office will do about 6 to 12 surgeries. Right now, they're only doing 1 or 2 a week, and only the ones vital to a patient's comfort level. She's hoping if all goes well, Bailey will have surgery on Wednesday. We do have more on all the changes her office has had to go through during this pandemic. For more on this story, go to our website at ktvl.com.